Hi, Jorge. How are you?
Pretty good. How are you?
I'm doing great. I'm glad that you're looking at the pamphlet.
The nurse told me you might be talking to me about it, but I haven't read it all.
Okay, well, it just tells you how I'm talking to all my patients during every visit about their sexual health concerns or questions, especially how to keep themselves, how to protect themselves and their partners.
Oh, I see.
Yeah, now that your virus is undetectable, I'd like to ask you a few questions about your sexual health, if that's okay.
Sure.
Okay, great. First, have you been sexually active since your last visit?
Yes.
Okay. Your partners, have they been men, women, or both? And how many partners in the last 3 months?
Jeez, I guess I should have read the pamphlet.
Well, you know, the reason I ask is because your sexual health is very important to your overall health. I mean, the steps you take to protect yourself and your partners are just as important as you making sure you keep up with your meds.
And we did talk about adherence a lot.
Exactly. So, if you don't mind, tell me a little bit about your partners.
You said the last 3 months?
Yes, but if you can't remember that far back, then let's just start with this past month.
Yeah, okay. The last month I was with about 4 or 5 men.
Okay. Now, you know, sex means different things to different people. So when you say you've been with these men, what exactly does that entail?
Well, this seems kind of personal. Does the type of sex matter?
Well, actually, yes, because it helps me understand how to better advise you on ways to protect yourself and your partners.
This makes me really uncomfortable.
Well, I'm sorry about that. I can understand why this conversation would be uncomfortable, but it really is important to your health. So, if you don't mind, I'm going to get a little bit more specific. Are you having oral sex or anal sex?
Yes, both, sometimes.
Okay. How often are you using condoms when you have anal sex?
Mostly. Well, none of the time.
Okay. You know, when you have unprotected sex, you could pass the HIV to your partners.
But you said the virus was undetectable, so...
Well, actually, undetectable means that the virus is being suppressed low enough that the test can't detect it.
Oh, so what does that mean?
Well, it means it's still there. And when you have unprotected sex, like I said before, not only can you pass the virus to your partners, but you can get a sexually transmitted infection or even a strain of HIV that's different from the one you currently have.
Oh.
I gotta tell you, I'm really glad that we're talking like this. I mean, it's my job to do everything I can to keep you healthy, and that includes talking openly about sex so that you can make healthy choices.
Okay.
So, between visits, is there something that you'd like to work on? Like maybe using condoms next time you have sex?
I guess so. It's just, I really hate dealing with them.
Well, I understand. Tell you what, will you be willing to talk to Raul? He's one of our health educators, you know, about your concerns with using condoms. I'm sure the two of you could brainstorm a couple of options.
Sure.
Okay, great. So our next visit, next time I see you, will be in 6 months. So we'll talk about how all this is going for you, as well as how else we can work together to keep you healthy and safe.